It's called tech neck, sagging skin under the chin caused by constantly looking down at our mobile devices. There are several non-invasive procedures, though, to help get rid of it. And here to show us how it all works is Dr. Dr. Shel, we'll call her, with the Wellness and Medical Spa. Good morning to you.
Good
Thanks
morning.
for being here.
Of course.
I'm glad you're here to talk about this. It's
Thank you.
so important to realize there are options,
There
right?
are, absolutely. So, you know, a lot of us are using our technologies all the time. Technology is great. However, it does have drawbacks. One of the drawbacks is exactly what we're talking about
and
today.
You're just talking about the loose skin, and that
Yes.
happens from just looking down.
Absolutely. So when we keep looking down, what's happening is the gravity takes over and we start experiencing sagging skin, laxity, crepiness, fine lines and wrinkles around the neck and the décolleté.
What's happening right now?
So what's happening is we're conducting the procedure called therapy, and as you can see on the screen, we're actually able to see where we're going in the patient's skin. So this is the only FDA-approved device that uses ultrasound technology, which, as you know, has been around for over 50 years, tried and true, to be able to stimulate the patient's own collagen with ultrasound energy, going as deep as most cosmetic surgeons go.
Ultrasound sounds simple. Is there any pain involved with that?
I wouldn't call it pain at all. Most patients don't need any topical numbing. They don't need any kind of pain medications or anything. And the greatest thing is they go right back to work. So non-invasive, non-surgical, no downtime, and stimulating your own collagen.
How's our patient feeling right now? What do you feel?
Right, just not anything really.
Just a little bit of pressure, maybe?
Yeah,
okay.
a little bit of energy.
And then she's going to see those results. Again, is it going to be drastic or is it going to be subtle?
Quite drastic. So it's not going to be like a facelift where you really pulled everything up, but it definitely lifts, tightens, and tones the skin. So you really see incredible before and after images. And when we look at these patients, it's just amazing what they're seeing. They're seeing several millimeters lifting on the neck, the décolleté, the jawline, the eyebrows, everything comes up. And some people actually look like they've had sort of a mini facelift done.
Now, we all know, though, that we're not going to get rid of those devices. So then what happens? Because you're aggravating the problem the whole time. How long will it last?
So it depends on the person and depends on how well you take care of your skin. We have a very big wellness approach. So I always recommend to my patients, stay out of the sun, you know, keep your head neutral as much as possible rather than looking down. And then we also really do a big focus on nutrition and bioidentical hormones because you want to keep that area stimulated with healthy care and really putting the nutrients back into your skin. So it could last a year, it could last a couple of years. You might need like a little maintenance treatment around the neck, but most people just a single treatment, and within a few weeks, 2 to 3 months, they're starting to see an incredible result where they look fresher, more youthful.
One of the first things viewers always ask me, okay, can I afford it? Is it affordable?
Well, it really depends on what area we're treating. So if we're treating just the neck versus a lot of people like to treat all the way from the face down to the décolleté. So it could range anywhere from about $1,500 and it can go up all the way to about $5,000 or so.
Now, we're almost out of time because you have one other device I want you to tell us about real quick.
Yes, so this is a great device. It is microneedling, and what you do is you put this sterile adapter on it. What we do is we actually use the patient's own plasma-rich platelet-rich plasma. What that is we draw the patient's blood and then we spin it down in a special centrifuge. Each of us has 10 or more collagen growth-derived factors, and those collagen-derived growth factors will be placed into the skin with microchannels using this microneedling device so that our own collagen is going to stimulate the skin, getting rid of sun damage, large pores, fine lines, wrinkles, and it could be anywhere on the body, face, neck, chest.
Fascinating.
Yes, it's really great.
Okay, well, we're going to get all this information on our website at myfoxhouston.com. Thanks for being here today and for showing us.
Great to be
here.
And
Jose, I was practicing this earlier.
Absolutely.